I'm Dr. Weckel. I've been practicing chiropractic here in Wilmington since 1987. Many times we have an older patient that is leery about coming to the office, or a medical doctor that is leery about sending an older patient to our office, or particularly a patient that has a herniated disc with sciatica, because they think that the only way that we're going to treat a low back condition is using the more forceful side posture lumbar roll technique, in which the patient is on their side and we do a thrusting maneuver and we get that typical pop or crack out of their back. Now, I can understand that you'd be a little bit leery about that, but however, in the hands of an experienced chiropractor, that technique is very safe. However, I want to try to demonstrate to you a new technique that is well time-tested in many chiropractors' offices, and we do it a lot here. It's called Flexion distraction. It's a very safe, very gentle, very controlled technique, and this might change your mind about coming to our office. Now, as you can see, the patient lays prone or face down on the table. Arms are very comfortable. The abdominal pieces drop down to maintain the normal lumbar lordosis. What's nice about this table is I can drop that piece down even lower, which can accommodate then larger abdomens, or many times we'll see a patient that's pregnant. And so a pregnant tummy can go down there very nicely. Initially, when we start out with an acute patient, we do not strap in the ankles. And this table gets released, and you'll see it'll go in many different directions. It'll go into lateral bending. It'll do what we call circumduction, but primarily we will use this in what we call the flexion distraction mode. I'll take my hand, I'll contact the patient's low back, I'll contact the segment that I want to get, and we can start out in a very easy motion, very gentle. This is very controlled. I can get feedback from the patient, both verbally, in the sense that, does this hurt? Am I using too much? What segment is actually the problem? But I also get feedback from my hand. I can actually feel, are there any muscle spasms? Is there a ratcheting type of motion that I feel going one direction versus the other? Now, this technique is very good for things like facet syndromes, for severe osteoarthritis in older patients where there's a lot of disc degeneration, facet joint arthritis. Very good also for spinal stenosis, but primarily one of the things we really like to use this table for is when there is a herniated disc with sciatica. In that case, I actually can strap in the ankles. I can actually distract the patient just a little bit longer, a little bit farther down, and we get more of a true spinal decompression by using this table. This technique is much better than the spinal decompression ads that you might be seeing in the newspaper. In that case, those techniques are more just like a glorified traction unit where the patient is just stretched, but there's none of the motion that we see actually that we get from this table. As you can see, very gentle table, very controlled. There is no spine too old, too arthritic that we can't treat with the flexion distraction table.